count, followed by the data collection process and a demo on the reports that we use to compile this information. We'll also go over the timeline and the project setup form and bed inventory, and then end our call with a Q&A session. I know that some of this might feel repetitive, but we wanted to take the time to go over the HUD updates or any changes that happened for this reporting purpose, or any changes to ensure like everything runs it smoothly. And it's also a great opportunity for everyone, especially our new agency members, to speed up another successful federal reporting season. Next slide, please. Okay, so what is the point in time count? The point in time count is then in duplicated count of both sheltered and unsheltered homeless individuals and families on a single night during the last 10 days of January. This count is mandatory by HUD and serves a snapshot of homelessness in our community. And this data helps the data that we collect helps us understand the demographics, characteristics of those experiencing homelessness, such as veterans, youth, and families. Both of the sheltered and unsheltered population data are included on this count. Once the data is collected, it gets submitted to HUD, where it's compiled with other state data to assess homelessness on a national level. Next slide, please. Thank you. So why does the PIC count take place during the last 10 days of January? The reason is because it's to be consistent with nationwide snapshot of homelessness. The timing is intentional, occurring in winter to maximize resources and capture a critical period when people are more likely to seek emergency shelter or crisis services. And holding the count at the end of the month also provides a clearer picture of those experiencing homelessness, including individuals who may only afford temporary housing, such as motels, earlier in the month after receiving their benefits. Next slide, please. Thank you. So why is the point in time count important? I've already went over this a little bit earlier, but it is a critical as it directly impacts funding and resource allocations for homeless programs. Federal and state funding decisions, including COC program competition, our NOFO, heavily relies on this data. The count also helps us measure progress in addressing homelessness locally and nationally, and it provides valuable insights to identify trends, improve strategies to ensure that we're effectively serving our communities. Additionally, the PID is also used for informing annual homeless assessment report, or AHAR, which is presented to Congress each year to advocate for more federal funding for homeless programs. And it also supports our COC in our local planning efforts. Next slide, please. Thank you. All right, now we move on to the data collection process. This slide is more of like a revisit of the HUD data standard changes that was introduced last year. Because while it doesn't directly impact, it does actually directly impact the point in time count. It does also impact your day-to-day data collection practices. So that we wanted to just go over it one more time to make sure that it's fully understood. So in the past, there is a race and ethnicity field. There were two sections to collect the race and ethnicity. That has changed now to to be combined into race and into a single element where it's race and ethnicity. Um, so when reporting to HUD, HUD COCs will report based on like the following categories. So if, let's say, someone identifies as African American and Hispanic, now they can select Black and African American and Hispanic and Latino. Similarly, someone identifying as Middle Eastern and Asian, they can select both Middle East and Asian categories. So this creates duplication. Can you go back to the slides, Lizzie?
Yeah, sorry, I don't know what happened. Just a second. Okay, we should be good to go.
Okay, perfect. Thank you, Lizzie. Okay, so when reporting more than one race or more than one selection, we might run into duplicate reporting. So HUD's report always organizes the response based on the information you provided. So make sure that if more than one race and ethnicity group is selected, you include those. And then when we report to HUD, you'll see that there are different breakdowns of these the data itself. So I think when Lizzie goes over those PIT and HIC report, you'll see what I'm trying to explain here. But these are the changes, and it's a little confusing, but um, you're on your end, all you have to do is just select those that applied that represents the client, and then we go from there. And if you need help in like reading how to um, explain, understand these data collection, definitely reach out to HMI support and we'd be happy to support you. Next slide, please. All right. So when it comes to the gender update and data collection, it's fairly straightforward with only minor adjustments made. So the HUD data standard included additional options so that you have more selections like different identity, non-binary, and culturally specified identity. So you have more selections and it's still pretty straightforward, and you can select more than one gender group here as well. Next slide. All right, now we're moving on to the housing inventory count. And the HIC is a way to measure all beds and units in our community that are specified and set aside to help homeless people experiencing homelessness. And it shows what housing resources we have available on the night of the count. For permanent supportive housing programs, since we include the permanent housing programs such as rapid rehousing and permanent supportive housing, we include people who are homeless when they first entered the program. The HIC helps us understand how much housing support we can offer and highlight any gaps that needs to be addressed. And this information, as I mentioned earlier, is used both locally and nationally to improve planning and funding for homeless services. Okay, next slide. Okay, I think that's the one. So what to include in the HIC? So HIC is designed to be an accurate reflection of the continuum of care's capacity to house homeless and formerly homeless person. So therefore, it is a complete count of emergency shelter, transitional housing, permanent supportive housing, beds available on the night of the count and in the COC. So before including the inventory on the report, just the goal is to ensure that is the primary intent of your program to serve homeless individuals, and does the program verify homeless status as part of the eligibility process? And if that is a yes, we will include it on the HIC. So the inventory includes all HUD-funded residential program as well as non-HUD funded programs that provide housing to homeless persons. Next slide, please. So I already over this briefly, but the projects to include are all emergency shelter programs, including youth shelter, hotel and motel units, a campground space paid for in emergency shelter vouchers, and all transitional housing programs, including homeless youth. And then in terms of permanent supportive housing, we include permanent supportive housing programs and rapid rehousing programs. So I think most of you are HMIS administrators already know what type of projects should be included on the HIC, but this is more of for agencies not participating in HMIS. So we do have some agencies or agencies that participate in HMIS, but they have some projects that don't get tracked into HMIS. They have their own tracking system for that. So in those cases, we still ask that you provide us the project setup, the inventory and the point in time count data for non-HMIs participating agencies. And in this case, what we normally have done in the past is provide the HIC and the PIT spreadsheet that Lizzie will share shortly, and then have you provide us like a summary of the number of individuals you've assisted on the night of the count so that we have a complete picture of our community's resources and the need. Next slide. Just wanted to add, like, if you know any agencies or programs that are operated outside of HMIS, please let us know, and we'd be happy to connect with you separately and work with you to gather that data. Um, so this slide is more of like to provide a relationship between the shelter point and time count and the housing inventory count. Um, the differences and some similarities. So the shelter point and time count report information about those individuals and families residing in an emergency shelter and transitional housing and safe haven programs identified on the HIC, but it excludes permanent supportive housing programs like rapid rehousing and permanent supportive housing. The PIC count aggregates these clients at the COC level, reporting the total number of sheltered households and people for the COC subpopulation and population breakdown. And the PIT also groups together the type of shelter and housing the clients staying in, rather than grouping people together by individual projects, as the HIC does. Because the sheltered pit and the HIC data must match, it's critical that our COCs, or we conduct the pit and the HIC on the same night so that it captures the same data. If I didn't mention this earlier, but if you have any questions on how to on like the sessions that we're providing today on the training, feel free to unmute yourself or raise your hand feature on Teams to ask your questions. I should have mentioned that at the beginning, but totally forgot. Okay, so for this slide, I would like to share our project and setup form. Um, 1 second while I do that. Let's see. Go ahead. Okay. I apologize. It's taking me a little longer to pull it up. Okay. So, okay. Can you see my screen? Can you all see?
I think we're seeing your folder, Salam. We don't see the project
Oh
setup
no.
form.
Okay. Let me go ahead and um see. Right about now. Can you all see it or
Yes, we can see it
okay.
now.
Awesome. Thank you. So for this slide, I just wanted to provide an overview of the project setup form and emphasize some key points to help agencies correctly fill out these forms because we addressed common questions in the past, especially during our reporting period, like the LSA on funding source, inventory, and so on. So we want to make sure that we address it during the session so that for the hit count, we're ready to conduct the count and provide all the required information. So I'm going to start from the first page. The first page of the form captures basic agency information, program name, and project start date. So for the project start date, it's very important to enter the date your project started serving clients or began operating. If there was, let's say, a gap between the operation start date and the first client enrollment, try to ensure that the dates are as close as possible because on our LSA, we had questions from HUD why there's a significant delay between these events. We had incident where a program started operation date is in 2023, but the project didn't start serving clients until 2024. So that's a huge gap and creates a question for HUD, and then they will reach out to us and say like, why is this the case? And we have to fix it. So try to ensure that these dates are as close as possible. For the coordinated entry access point, if you provide any coordinated, if you want to work or with the CES, just select yes, and then indicate the type of services you provide. So if it's a housing assessment, crisis referral, or direct services, make sure you indicate the services that is directly linked to your program. Not all of them apply, but if each of these services apply to your program, feel free to select all of them or some, depending on the project that you're providing services to. And then the coordinated entry participation status and end date depends on when you began participating in CES. For the project type, we've had a couple of questions about the program type. So I'm actually going to ask Lizzie, do you mind putting HUD's definition in the chat, the link to the HUD's definition so that our HMIS administrators have access to it? So it's always important to refer to the HUD's definition to ensure that you're selecting the correct project type, such as emergency shelters, permanent housing, rapid rehousing, and all the intervention types are included on our HUD's website. So if you have question, always refer to that. And if you're not sure which project type to include, also reach out to us and would be happy to support you. So as I mentioned earlier, each of the project type has specified data collection requirements. So unless it's labeled correctly, we might run into issues where the data is not collected based on the correct program, especially if the incorrect project type is provided. So it's important to provide the correct project type that applies to the services that you provide. So in terms of site location, if your program, we do have different selections here, site-based, single site, clustered site, and scattered site. So if your program operates at a single site, provide that site address. And if you have clustered or multiple site, provide the address or location where the majority of the units or beds are located, or and sometimes in rapid rehousing cases where most of your clients reside in. So that would be the unit or apartment complex where the most of your clients you're serving reside in. That would be the address that we will need from you. Um, and and then we appreciate full address, but if you can't provide us the full address, especially for the single site and clustered or multiple sites, we would appreciate getting at least a city and a zip code, as those are required when reporting our HIC to HUD. Okay, scroll it up here. So in terms of the geocode, so you would enter the geocode associated with the geographic location of your program service site. So if you run into difficulties where you're not sure of where these geocodes are located or if your city, if you were not sure of like the geocode for the city that the site is located, we have a link to that at the end of our PowerPoint presentation, so we'll also include it in the chat for you, and feel free to refer to those to put the accurate geocode. Funding sources. This is all of them, or all of these points are very important, but I just want to make sure like the funding source piece is always a question for HUD, and they always follow up with us. So make sure that, so on our project setup form, we have all of the HUD funded um, funding sources as well as federal funding sources. We try to put as much information, all of the funding sources as possible. But if you're missing any that are federal and state funding sources, feel free to let us know and we'll be happy to add it. But make sure that the funding source is selected for your program. Otherwise, we'll return it back and say, oh, you need to provide the correct project funding source. And as I mentioned earlier, this is very important because the funding sources often have specified data collection requirements. So if we have an incorrect funding source added to the program, it will impact your reporting process later on when you have to submit to HUD as well as federal. Okay, and now moving on to, um, sorry, okay. So the inventory piece. So for the funding recipients, just put whether you're direct recipients or subrecipients and so on. Um, and then there's a target population section, whether the program is dedicated to serve DV clients or those with HIV, AIDS, the HOPA programs, or if it's not applicable, select not applicable. Let's go ahead. Okay. Um, I think that's it for this section. So now moving on to the inventory section. Um, this section is required for housing projects specifically. So if you have emergency shelter, permanent supportive housing, rapid rehousing, and transitional housing, it is required that you provide us the inventory data. Um, when it comes to bed type, indicate the program that is applicable, the bed type that is applicable to your program. So if it's a facility based, select facility based. Vouchers are the motel based, and facilities like shelters. So other, you would select other depending on what type of funding or what type of bed type you have for your program. Um, for the number of beds and units, ensure that the bed type matches the household type for your program. So if you're serving only adults, which are household without children, um, those beds and units should be listed under household without children. And then for families, you would go under families with one adult and then provide us also the units. And if these household type or like the population that you serve change over time, which it happens depending on your funding source, please notify the HMIS team, send us an updated project setup form so that we can update the system to reflect accurate data or inventory data for your program. We also have added like a special population section. Let's say like if you have beds dedicated to veterans, chronically homeless, and youth, make sure that they're indicated here. I know it's like written very small, so it's hard to, once you're done with this piece, it's easy to forget this piece. So we ask that you provide us if you have dedicated beds to these population group. Um, and then if you have any seasonal beds, we would need that information as well. Um, I think that's it for the project setup form piece. I will now pass it over to Lizzie to go over the point in time count and the housing inventory count reports.
Hey everybody, thanks so much for joining today. We appreciate you guys being here. I realize some of this information for some of you is information you guys are veterans at, and some of this information might be new for some of you. So we appreciate all of you guys being on this call. Like Salam said, we welcome questions, and please feel free to stop us, raise your hand, unmute, whatever you're comfortable with if there's anything that pops up. So I wanted to take a minute to go over both the point in time count spreadsheet I'm showing right now, and then after this we're going to review the housing inventory count spreadsheet. So I think I'm just going to give a little bit of an overview of how to read them, because when you're looking at it with lots of cells and squares and rectangles, sometimes it's a little bit confusing. So I'm just going to give kind of a breakdown. When we're looking at the sheltered pit count, um, this is going to be broken down by the households. So it'll be broken down by all households, like that would include all individuals combined together, and then veteran households, and then youth households. Those are going to be the three specific populations. And you'll see that by this like blue rectangle right here is what type of household we're looking at. So within each of those three larger categories, the all households, veterans, and youth, there's going to be household subpopulations, and that's going to be based on whether or not there's children in the household. So we're looking currently at households with at least one adult and one child, so households with children or families. And when we're looking at this data, also as a disclaimer, all of this is fake data. It was pulled off of our training site, so none of this data is real. But when we look at this data, it's going to essentially, for each one of these subcategories and households, it's going to go through and request that we provide the total number of people served, or it's going to capture that number, along with an age breakdown, a gender breakdown, race and ethnicity breakdown, and number of people chronically homeless. So those same categories are going to be repeated under each of these subpopulations for each of the household types. So for households with at least one adult and one child, it will give you the category on this side. And then it's going to, in these columns, it's going to be counting the number of people who are either sheltered in an emergency shelter or sheltered in a transitional housing unit. And then it will provide the total number of individuals in this third column over here. So the total number of households is the first row, total number of persons is the second row, and then it's going to go into a breakdown of all of the ages that we'll find. So as we're going through each of the numbers, the way that it's set up is all of the totals have to check out. So here it's showing that in this program specifically, there's only 2 people total. So we're never going to have more than 2 people reflected down here under the number of people who are falling in each age category. So it looks like there's one child in this program and there's one person between the ages of 35 and 44. So it would make sense that there's only 2 people that fall under, one of these age categories because there's only 2 people total served in this program. So that is going to be consistent when we're looking at all of the different breakdowns Like Salam mentioned, there's several gender categories here that may look a little bit new to you from years past, but it's going to be the same deal here. It's going to give you the category on the side of which gender category, and then the number of people who are falling in that category, whether it's the number of people who are in an emergency shelter or the number of people in transitional housing. So hopefully, this will be pretty straightforward. A lot of you guys I know either only have an emergency shelter program or a transitional housing. Some of you may have both, and that's when we'll just need to make sure that the total number of people in both emergency shelter and transitional housing and your totals are all checking out. We're basically just asking you to verify that any information you're reading on here matches your records of the people served in your program. So it's going to continue. Oops, it's going to jump here. So we're looking here at gender. There is an option for people to select more than one gender if they identify as more than one gender. So it's giving a disclaimer here of those that selected more than one gender. They would like to know how many people reported each gender identity. And then it's going to be the same for race and ethnicity. And then the same for chronically homeless. So they're going to want to know how many people um, are experiencing chronic homelessness and how many households are experiencing chronic homelessness. So those general categories between number of people served, age, gender, race and ethnicity, and chronic homelessness are going to be consistent. So this is showing a different household type. This is now households without children, so an adult only. And you're going to see all of the exact same categories. So here is the age categories and the gender categories, and then the race and ethnicity categories, along with chronic homeless. And then it's going to transition now into a new household type of households with only children. So child-only households, no adults are in these households. And it's going to come up with the same breakdown. There's only one age category because it's only for children. And then gender, race and ethnicity, chronic homelessness. Um, So you're going to see very consistent, a lot of consistency here in how it's organized. Now we're transitioning into veteran households, and it's going to be the same deal. We're going to start with veterans households that are families. They have at least one adult and one child, and it's going to be the same breakdown, except the one difference is now it's going to request the number of veterans that were served in the program on the night of the point in time count, both emergency shelter and transitional housing. But all of the rest of this, um, when you're looking at this, it's going to be for veterans only. So it will tell you on these header categories of what it's looking for to count or what it's counting. Um, The same with race and ethnicity. It's looking for veterans only data. And then for chronic homelessness, it's only looking at the veteran households. And then you're going to see the same breakdown, but this time for households with children. But it's only going to be requesting, or it's only going to be reflecting the data shown for veterans. And then I'm going to go down to the youth. So it's kind of on a different page here, so it's hard to see, but we're transitioning into the youth households now. And so this one is broken down into two categories, the unaccompanied youth households and then parenting youth. And so it's going to ask, once again, very similar, all the same questions of those, their age breakdown, their gender breakdown. But just keep in mind here that it's only going to be reflecting unaccompanied youth in these numbers as well, the same way that veterans only reflected veterans, race, ethnicity, and so on and so forth. And then it will transition into parenting youth households. So households that have a youth as the parent, and then they have a child in the household with them as well. So that is kind of the breakdown of the of this spreadsheet. At the very bottom, there's going to be one last like breakdown down here, and it's just going to kind of show some totals of some additional homeless population, like subpopulations that we see. So it will have serious mental illness, substance use disorder, those who have been diagnosed with HIV or AIDS, or those who are survivors of domestic violence. So you'll see some of those totals down here, and it will let you know once again based on each column, whether it's emergency shelter, transitional housing, and then the third category here is safe haven. But Salam, correct me if I'm wrong. I do not believe we have anybody with a safe haven program.
That's correct.
Okay, so this will always be 0. But in terms of the point in time count spreadsheet, that is kind of how it's structured and organized. I know data is not everybody's favorite topic, so I hope you guys are all with me even after the post-lunch slump. Did anybody have questions over this before I move on? I know a lot of you are veterans already. Okay. If there's no questions, then Salam, can I move forward into the housing inventory count spreadsheet?
Sure.
Okay, perfect. Give me just a second, everybody. My teams went away. Alrighty. So the housing inventory count spreadsheet, once again, this is going to be information that we're requesting that you just verify for us. We want to make sure that all the information that we have that we're reporting to HUD is accurate. And so we need to make sure that it is complete and that it is that it's accurate. So we need your guys' help because you are our subject matter experts in your programs. And so we're gonna just request when you're reviewing these to ensure anything is accurate and matches what should be reflective of your program. So sometimes when a housing inventory count spreadsheet is downloaded, there will be some data quality items that pop up here. If there are numbers reflected here, there may be some data quality items that do need to be addressed. Here it's kind of outlining what data quality items are present. So it looks like in this data set, there is one individual with an undefined head of household. Um, and then there was one with a missing move-in date and one with overlapping enrollments. So each of these are data quality errors I'm sure many of you guys have seen and would need to be addressed in order to make sure the data is clean. And then I think sometimes there may be situations where a client is not yet housed, so they should not have a move-in date, but uh, this error will still pop up. So if we come across that, we can kind of tackle that together. And then with the rest of this spreadsheet, once we're down in this lower portion of the spreadsheet, what you're going to be seeing here is each of these rows, these 2 rows here, you may have more, you may have only 1 row. Each row is going to be reflective of a program. So however many programs you have will indicate how many rows are listed here. And this is we're going to request that you ensure that all of this information is complete and accurate. So for example, this program is missing a funding source. We would need to make sure that we have that information. So if we're sending, when we send this to you, if any of this information is blank, we request that you ensure that that information is portrayed to us so that we can ensure that complete information is submitted when we submit. So you're going to see each of these columns will indicate what information should be here. So whether it's your organization name, your project name, the type of project, the geocode, the funding source, so on and so forth, just ensure all this information is complete and accurate. And then the exciting stuff over here, where there are many a question, and I think will forever be many a question. If you have an emergency shelter project, some of these fields will be more applicable to you. If you only have a PSH or rapid rehousing project, some of these fields may not be applicable to your program. So for example, this emergency shelter bed type, is only going to be applicable to emergency shelters. So whether it's facility-based or voucher-based is going to be indicated here. Once again, we're asking you verify that that information is correct based on how your program operates. And then other fields and categories here that are specific to emergency shelters are whether your emergency shelter beds are seasonal. We would request the number of beds that you have available and then the start and end dates of those seasonal beds. And then if you have any overflow beds, which would occur in, for example, the case of like a disaster, which like if the Palisades fires are occurring right now, there's lots of people who are in shelters right now. Those would be considered overflow beds because that is an emergency situation. A lot of people are stepping in to provide shelter beds that maybe may not normally provide those beds. So those would be considered overflow beds. So if you have seasonal or overflow beds, you would reflect them here on the spreadsheet. But the rest of this portion right here of the spreadsheet is going to be applicable to all emergency shelter, transitional housing, rapid rehousing, and permanent supportive housing programs. So for the housing inventory count, we are going to want to know how many beds you had available on the night of the point in time count. And we're going to want to know how many of those beds were occupied on the night of the point in time count. So the total beds is the total number of beds available, and the pit count number is the total number of beds that were occupied. So these two numbers are specific to the point in time count, whereas the rest of these numbers are going to be requesting more your capacity of your program. A lot of times these numbers are based on your contract. So it will, these numbers should reflect the total number capacity that your program has. And then it will also let us know the number of units as well. So for example, it looks like this program serves households with children, and they have 15 units available and 30 beds available. So the beds are usually the number of individuals you have the capacity to serve, and then the units are the total number of units that are available. So you may have more beds than units. So that breakdown can usually be found in your contract of how many beds you have a capacity to serve. And then if you have a rapid rehousing or a PSH unit, or excuse me, program, then these numbers are going to be reflective of the number of people you have in housing on the night of the point in time count. And then you'll see there's the same special populations here as well. So if your program has beds reserved for the veteran population or the youth population or the chronically homeless population, we do request that you provide the number of beds that you have reserved for each of these special populations. And then whether or not those beds are reserved for households with children or reserved for households without children. Some contracts do not specify that they have any beds reserved for one of these three populations, and that's totally okay. You would only need to complete these numbers over here if it's households with children, and then these numbers here if it's households without children. But if if you are contracted to serve one of these three populations, you would just put the number of beds you have reserved for that population here. So for example, you may have 15 beds reserved for veterans, and then you may have 30 beds total. So you would put 15 veteran beds here, and you would keep this number at 30. So you have 30 beds total. So you would not add this number to this number. These numbers are going to be already included in the total number of beds that you have available. And then the only other section on this spreadsheet is going to be for households with only children under the age of 18. So if you are contracted to serve child-only households, we would need to know how many beds you have reserved for this household type, along with the total number of beds reserved for this household type that's chronically homeless. Are there any questions on this section? I know that's a lot of information, some new, some maybe not new, so please feel free to ask questions. This is always a confusing one, so please do not hesitate to ask questions.
Quick question. So just to clarify, we're going to be filling out this the day of point in time count with what we currently have within our organization's capacity?
Great question. So fortunately, for those of you who enter data into HMIS, this will already be completed for you, and we will be sending it to you and requesting that you verify all of the information on here. So this is an overview of how to interpret the information that's on this spreadsheet so that when you're looking through, you can check the records at your agency to make sure that this information is accurate. So the information on the housing inventory is a little bit more generalized. It's not specific to the night of the point in time count. It is more based on your contract for that program. It's your total program capacity. But these numbers here are specific to the night of the point in time count. We want to know how many beds total your program had available and how many individuals total you were housing on the night of the point in time count. Did that answer your question, Eduardo?
It did. Thank you very much.
Okay, awesome. Like Salam said, there are some agencies that have programs that are not entering data into HMIS. Like, for example, if they're a victim service provider, they're exempt from entering data into HMIS. They do have to complete this spreadsheet manually. You should not envy them because it's not very fun, but they are troopers with us. Were there any other questions? Okay, then I'm just going to briefly touch on some of the other information down here. Um, at the bottom, there may be some additional tabs for you to look through. The site information tab is going to be specific to your program site. So it will, once again, each row is going to be a different program. So we're going to ask that you verify that all the information is accurate between the project name, project type, whether it's a victim service provider program, and then the address. This is really more specifically what we're looking for here is we want to make sure that that site address is completed and not left blank. And then you'll just verify that for each of the program and projects here. And then if you have a tab here that's showing as a program without inventory, that means that we probably need to touch base and collect that inventory from you. So if this tab pops up, then we'll touch bases with you to ensure that we have completed inventory for all of your programs. Okay, guys, that is all I have for you for the demo for the HIC inventory spreadsheet and the point in time count spreadsheet. Hopefully that is helpful to you guys as you are reviewing these spreadsheets to ensure data is matching what's in your records. But at this time, I'm going to hand it back over to Salam and I'll start sharing the slides again, Salam.
Thank you so much, Lizzie, for going over the report in a very clear way. So that's great. It's confusing, the spreadsheets. So I'm glad that Lizzie explained it in a way it's clear for everyone. If you can go to the important dates to remember the timeline piece. All right. Okay, so now we go over the deadlines. So the night of the count, so the Riverside County will be conducting the HIC and sheltered pig count on January 22nd, 2025. So this will include for the unsheltered count will be conducted during the day, and then the sheltered piece will be the night of January 22nd. So we ask that you have to ensure that the data is accurate for the sheltered point in time count and all data is entered for the night of January 22nd and or the in the HMIs as well as the agency comparable basis by February 6th, 2025. So we usually, I think according to our charter, agencies must enter the data within 7 days, but we are it is a busy season, so as long as you can complete it by February 6th and ensure that everything is accurate, we'll go ahead and run a report on our end of the spreadsheet and the report that Lizzie just shared with you guys for the night of the count and start sending those out to you. Starting February 8th, 2025. So we'll send those to you to confirm. We'll include in the email, this is the data that you have, the inventories, and we ask that you confirm that information. And if then there needs to be any changes, you make those changes as well. Once we send those out, we ask that you provide that confirmation and finalize the HIC and PIT by February, respond back to us by February 15 so that we can finalize the HIC and PIT or the data on our end so that we can submit it successfully to HUD. So the important dates to remember is January 22nd, just ensuring that everything is entered in the system. And then if you know agencies or programs that you don't use HMIS system for, please let us know and we will work with you separately and send out these forms. And it looks very complicated, but we will work with you through every process to ensure that you have a successful completion of the data. Next slide, please. Are there any questions that we could answer here? And if not, if you have any questions, run into any questions, please send your questions to hmisupport@rivco.org, not just related to the HIC and PIT, but any questions related to HMIS. You would be using this support inbox where we all have access to it, and we'll be happy to support you. Next slide. Okay, so these are the resources that we have. We have the 2025 HIC and PIT data collection notice. It provides you a guideline into how, to collect the data, the HIC and PIT data, the requirements and all of the data collection processes. And we also have the geocode resource where you can go in and locate the cities and connect it to the geocode. And we also have a fit count methodology guide that you could use. So we will include that in the link and we'll also send an email with all of these resources to you. So, and that is our presentation. Does anyone have any question? Like there are none, and it's 2:59, and we'll go ahead and end our call. And just want to thank you for joining this call and listening to this and all you do to support the homeless population. So if you have any questions, feel free to reach out to HMI support. And thank you, and have a good one.
Thank you, everybody.